2 o'clock in the morning. Your bedroom is dark. You are completely still, deep in sleep, and you have no idea that right now, in this exact moment, your heart is under mechanical stress. Not because of a disease, not because of something you ate, because of the position your body is lying in. Every single night, millions of people go to bed in a position that quietly, steadily overloads one side of the heart, not over years, not over decades, overnight. 7 to 8 hours of sustained, uninterrupted pressure on a muscle that never gets a break because your heart does not stop when you sleep. It keeps pumping. And the position you sleep in determines how hard it has to work to do that job. Most people treat sleeping position as a comfort preference. Left side, right side, flat on the back, whatever feels good. That is not what it is. Sleeping position is a cardiovascular decision. It changes blood flow. It changes the pressure inside your chest. It changes how much fluid your heart has to move and in which direction. Get it wrong, and you are running a stress test on your heart every single night without knowing it. Nobody tells you this. Not your cardiologist, not your GP, not anyone. A 12-minute appointment does not cover sleep biomechanics. There is no billing code for teaching you how gravity affects your heart at 2 o'clock in the morning. The system is built for prescriptions, not for prevention. That is exactly why this channel exists. Subscribe and hit like right now. Help Dr. Johnson reach 200,000 subscribers. Every single one counts. What you are about to hear could change how you sleep for the rest of your life. Let me start with something most people get wrong. They think sleep is rest. They think the heart slows down, the body shuts off, and everything just idles until morning. That is not what happens. Not even close. Yes, your heart rate drops during sleep. Yes, your blood pressure dips by roughly 15 to 20%. But your heart does not stop working. It enters a recovery and remodeling phase. This is when damaged cardiac muscle fibers repair themselves. This is when your heart's electrical conduction system, the internal wiring that keeps your heartbeat rhythmic and coordinated, recalibrates. This is when your body rebalances fluid between your blood vessels, your tissues, and your organs. That recovery phase is not optional. It is essential. Skip it or disrupt it, and the damage accumulates silently, night after night. Now here is the part that matters for everything that follows. Sleep is the single longest uninterrupted period your heart operates under one consistent set of mechanical conditions. During the day, you shift positions constantly. You stand, you sit, you walk, you lean. The forces acting on your heart change every few minutes. But at night, you settle into a position, and you stay there for hours. Whatever mechanical load that position places on your heart absorbs it continuously for the entire duration. If that position is correct, your heart recovers. If that position is wrong, your heart endures 7 to 8 hours of sustained stress that it was never designed to handle in one unbroken stretch. And you wake up with no idea it happened. By the way, a lot of you have already been checking out Care Health. That is the link on my channel page. If you have not looked yet, it is worth it. All right, let us get into what actually goes wrong. To understand what happens to your heart at night, you need to understand one force that never turns off: gravity. During the day, when you are standing or sitting, gravity pulls blood downward into your legs and feet. Your veins, your muscles, and a set of tiny one-way valves inside those veins work together to push that blood back up toward the heart. It is a constant fight against downward pull, and your body manages it, more or less. Now picture a plastic bottle half filled with water. Hold it upright, and the water sits at the bottom. Lay it on its side, and the water spreads evenly across the entire length. Your body works the same way. The moment you lie down, the playing field levels. Blood that was pooled in your lower body all day, roughly 1 to 1.5 liters of it, suddenly redistributes. It moves toward your chest, your head, and most importantly, straight into your heart. Specifically into the right atrium, the first chamber that receives returning blood. In a healthy heart, this is a non-event. The right atrium accepts the extra volume, passes it through the lungs, and the left side pumps it forward without difficulty. The system handles it the way it was designed to. But in a heart that is already compromised, even mildly, even in ways you have never been diagnosed with, that surge of returning blood becomes a problem. The right atrium stretches beyond its comfortable range. Pressure builds in the pulmonary circuit. The left ventricle, already working less efficiently than it should, suddenly has to move a volume it cannot keep up with. You did not sign up for a cardiac stress test. But every single night, the moment you lie flat, that is exactly what your body runs. and you sleep right through it. Now let me address something you have probably seen online. The claim that sleeping on your left side is bad for your heart. It is all over the internet. Some people swear by it, others dismiss it entirely. The truth, as usual, is more specific than either side admits. Here is the anatomy. Your heart does not sit in the center of your chest. It sits slightly to the left, nestled between your lungs, angled so that the tip, the apex, points toward your left hip. When you lie on your left side, gravity pulls the heart toward the chest wall. In a healthy person with a normal-sized heart, this shift is negligible. You will not feel it. It changes nothing. But in someone with an enlarged heart, early-stage heart failure, or pericardial effusion, which is excess fluid in the thin sac surrounding the heart, that gravitational shift adds real mechanical pressure on the left ventricle. The left ventricle is the powerhouse of your entire circulation. It is the chamber that contracts with enough force to push blood into the aorta and out to every organ in your body. Any compression on that chamber, even modest, reduces how efficiently it pumps. Do that for 7 hours straight, and the heart is working harder than it needs to, all night, every night. So the right side is safer? Not necessarily. Lying on your right side reduces direct gravitational load on the heart, yes, but it can increase venous return through the inferior vena cava, the large vein that carries blood from the lower body into the right atrium. In certain conditions, that increased return overloads the right side of the heart instead. Here is the honest answer. There is no universally safe side. It depends entirely on the current condition of your heart, and most people have absolutely no idea what that condition is. Now we get to the position that causes the most damage, and the one almost everyone defaults to. Lying completely flat on your back, no elevation, head level with your chest. I want you to meet a patient. I will call Margaret. 61 years old, retired teacher, no major health complaints. For the past 8 months, she has been waking up at 2 or 3 in the morning unable to breathe. She sits up in bed, gasping, heart pounding. After a few minutes upright, the breathing settles. She lies back down and eventually falls asleep again. She told her daughter it was anxiety. She told herself it was just getting older. When she finally came to see me, I asked one question. How many pillows do you sleep with? She paused. 3, sometimes 4. She said she just could not get comfortable lying flat anymore. She felt like something was sitting on her chest. Margaret was not anxious. Margaret was in early-stage heart failure, and she had been self-treating it with pillows for 8 months without knowing. Here is the mechanism. When you lie flat, venous return to the heart increases dramatically. We covered that. In a healthy heart, the left ventricle handles the extra volume, but when that ventricle is weakened, even mildly, it cannot pump the blood forward fast enough. Blood backs up into the pulmonary veins. Pressure in the lung circulation rises. Fluid begins to seep out of the blood vessels and into the lung tissue itself. That is pulmonary congestion. In medicine, we call this orthopnea, difficulty breathing when lying flat, and paroxysmal nocturnal dyspnea, the sudden nighttime gasping episodes. These are not random. They are the single most classic early symptoms of left-sided heart failure. Most people blame a bad dream. The heart knows better. If you watched my video on nighttime urination, you already know about the fluid that hides in your legs during the day. You know about the swelling, the gravity, the sock grooves. But in that video, we followed the fluid to the kidneys. Today, I want you to follow it somewhere else, to your lungs. The mechanism starts the same way. You spend 14 to 16 hours upright. Gravity pulls fluid downward into the tissues of your calves and ankles. Veins lose elasticity with age. Valves start to leak, and up to 1.5 liters of water quietly accumulates in the soft tissue of your lower legs. You may not even see visible swelling. The sock left a groove. So what? Then you lie down. Gravity releases its grip. That stored fluid drains back into the bloodstream. Within the first 1 to 2 hours of sleep, blood volume in the central circulation surges. In my bladder video, I explained how this surge hits the kidneys and produces nighttime urination. That is the kidney pathway. But the fluid has to pass through the heart first, and that is where the cardiac pathway begins. The returning blood enters the right atrium. It moves through the right ventricle and into the lungs. Then it reaches the left ventricle. If that chamber is even slightly weak, it cannot push this wave forward fast enough. The blood backs up, fluid pressure in the pulmonary vessels rises, and the lungs begin to fill. If you watched the bladder video, you already know the shin press test. Press your thumb into the bone of your lower leg, hold for 10 to 15 seconds, and check for a pit. But now I want you to understand what that dent means for your heart, not just your kidneys. That hidden reservoir in your legs is loading your lungs every single night. Everything I just described, the fluid surge, the venous return, the pressure on the left ventricle, gets dramatically worse if you have one specific condition. And the chances are higher than you think that you do. Obstructive sleep apnea. The airway collapses during sleep, blocks airflow for seconds at a time, and then reopens with a gasp. Most people who have it do not know. They think they snore. Their partner nudges them, they roll over, and life continues. But what is happening inside the chest during each of those episodes is far more violent than a snore. When your airway closes and you try to breathe against a sealed throat, your diaphragm pulls down hard, but no air comes in. That creates a powerful suction effect inside the chest cavity. The pressure inside your rib cage drops sharply, and that negative pressure yanks on the walls of your heart like a vacuum pulling on a balloon. The heart stretches in directions it was not designed to stretch. At the same time, your body panics. It does not know why air stopped, so it floods your bloodstream with adrenaline. Heart rate spikes, blood pressure jumps. This is not a gentle nudge. This is a full emergency response, and it can happen 30, 40, sometimes 60 times per hour while you sleep. Now here is the positional connection. The single biggest risk factor for airway collapse is lying flat on your back. In that position, gravity pulls the tongue and the soft palate backward, directly into the airway. The same position that increases venous return to the heart. The same position that overloads the left ventricle with fluid also maximizes the severity of sleep apnea. Two separate mechanisms, both made worse by the exact same sleeping position. Your heart absorbs both hits simultaneously, every single night, and most people have never been tested for either one. There is a number your doctor checks during the day that behaves very differently at night. Blood pressure. During normal sleep, blood pressure drops by roughly 10 to 20%. This is called the dipping pattern, and it is healthy. It gives your heart and your blood vessels a few hours of reduced workload. Think of it as the one shift where the system runs at lower intensity. Your heart needs that break. But not everyone dips normally. In some people, blood pressure crashes too far during sleep. Doctors call this extreme dipping. In others, blood pressure does not drop at all, or it actually rises overnight. That is called non-dipping or reverse dipping. Both extremes are dangerous, and most people have no idea which pattern they fall into because nobody measures blood pressure at 3 o'clock in the morning during a routine checkup. Here is what happens at each extreme. If you are an extreme dipper and you already have narrowed coronary arteries, the arteries that feed blood to the heart muscle itself, that excessive pressure drop can reduce flow through those narrowed vessels to a trickle. Heart tissue downstream does not get enough oxygen. This is called silent ischemia. Silent because it causes no chest pain. The heart is being starved, and you feel nothing. You sleep right through it. On the other end, if your blood pressure stays elevated or rises at night, your heart never gets its recovery window. It pumps against high resistance for 24 hours straight. That pattern is directly associated with heart failure progression, stroke, and kidney damage. Now the critical point, body position influences which pattern you fall into. Lying flat amplifies fluid redistribution and increases cardiac workload. Elevating the upper body changes the pressure dynamics measurably. This is not a theory. It is the reason cardiologists tell heart failure patients to raise the head of their bed. The position you sleep in shapes the pressure your heart works against all night. I want to describe a profile. See how many of these apply to you. You are over 50. By the end of the day, your ankles are slightly puffy, or your socks leave a visible groove in your skin. You get a little breathless, climbing a flight of stairs. Not dramatically, just enough that you pause at the top and catch your breath. You wake up at night to urinate more than once. Your partner has mentioned that you snore, or that you sometimes stop breathing and then gasp. You have a history of high blood pressure, or your blood sugar has been called borderline at some point. And here is the one nobody ever connects. You need 2 or more pillows to sleep comfortably. If you checked 3 or more of those, you are carrying a cardiovascular risk profile that almost certainly has never been evaluated as a whole. Each item on that list gets treated separately. The swelling goes to one doctor. The snoring gets ignored. The blood pressure gets a pill. Nobody puts the full picture together. But the pillow count is the one I want you to pay attention to because it is the most reliable self-assessment you can do right now. Think back. How many pillows did you sleep with 5 years ago? How many do you use tonight? If that number has gone up, and especially if you have noticed that lying flat feels tight or suffocating, that progression has a clinical name. It is called increasing orthopnea, and it tracks directly with worsening cardiac function. You did not choose more pillows for comfort. Your body demanded them because your heart cannot handle the fluid load that lying flat produces. You have been self-treating a cardiac problem with pillows, the same way Margaret was, without knowing it. How many pillows do you sleep with? Write it in the comments, I want to know. Here is exactly what to do. Starting tonight. No vagueness, no generalizations. 5 specific changes. 1. Elevate the head of your bed by 15 to 30 degrees, not by stacking pillows under your head. That kinks your neck, compresses your airway, and worsens apnea. Instead, raise the entire upper portion of the mattress. Use a foam wedge that goes under the mattress, or place 4 to 6 inch bed risers under the 2 legs at the head of your bed. The physics are simple. This angle reduces the volume of blood that rushes back to your heart when you lie down. It unloads the right atrium just enough to prevent fluid overload without restricting circulation to your brain. 2. If you are a side sleeper, choose the right side. Less gravitational compression on the heart, more efficient venous drainage through the inferior vena cava. This is not a dramatic intervention. It is a small positional advantage that compounds over thousands of nights. 3. 1 to 1.5 hours before bed, elevate your legs. If you watched my bladder video, you already know this protocol. Lie on the sofa, put your legs up on the armrest or against the wall, heels above your heart, and stay there for 15 to 20 minutes. You are draining fluid from your legs while you are still awake. That is fluid that will not surge into your heart at 2 in the morning. 4. No salty food and no alcohol within 3 hours of sleep. Salt holds fluid in your tissues. Alcohol shuts down your antidiuretic hormone and disrupts every sleep phase your heart depends on for recovery. 5. If you snore, or if anyone has ever told you that you stop breathing at night, do not sleep on your back. A tennis ball sewn into the back of a sleep shirt is a low-tech positional therapy used in actual sleep medicine. It makes rolling onto your back uncomfortable enough that your body learns to stay on its side. Simple, effective, and cost nothing. If anything in this video sounded familiar, there are 3 specific tests worth asking your doctor about. Not as self-diagnosis, as a conversation. You walk in with a clear request, and you leave with numbers instead of guesses. The first is an echocardiogram. That is an ultrasound of the heart. It shows the size of each chamber, the thickness of the walls, and one number that matters more than any other, your ejection fraction. Ejection fraction is the percentage of blood your left ventricle actually pumps out with each beat. Normal is 55 to 70%. Below 40% is heart failure territory. This single test can detect early heart failure before you ever feel a symptom. If you have swelling, breathlessness, or a rising pillow count, this is the test that answers the question. The second is a blood test called BNP, or NT-proBNP, brain natriuretic peptide, that is a hormone released directly by heart muscle cells when they are stretched or overloaded. If your heart has been working too hard, this number goes up. It is a biochemical alarm. Elevated BNP means the heart is under strain, even if everything else looks normal on paper. It catches what a standard checkup misses. The third is overnight pulse oximetry, or a home sleep study. A small clip goes on your finger and records your blood oxygen levels through the entire night. In a normal sleeper, oxygen stays above 95%. If the reading repeatedly dips below 90%, that is a hallmark of obstructive sleep apnea. And as we covered, sleep apnea directly amplifies cardiac stress with every single episode. None of these tests are exotic, none of them are expensive, all 3 are available through a standard referral. The problem is not access. The problem is that nobody asks. Now you know what to ask for. Now, I know what some of you are thinking. I have tried talking to my doctor. I get 10 minutes, a basic check, and a prescription. Nothing changes. I hear that from viewers every single day, and I understand the frustration. That is exactly why I want to tell you about something that has been genuinely helping people on this channel. CareHealth. CareHealth is a platform that connects you with clinical trials and advanced treatment options for conditions like heart failure, sleep apnea, hypertension, and cardiovascular disease. These are not experimental guesswork. These are monitored, structured medical programs run by real research teams, and many of them offer a level of care, monitoring, and attention that goes far beyond what a standard office visit can provide. Here is what changes for you. Instead of waiting 6 months for a follow-up and hoping your numbers improve, you get access to cutting-edge treatments, regular checkups, detailed monitoring, and medical teams that actually have time to explain what is happening inside your body. Many of these programs even cover the cost of treatment, travel, and testing. You are not paying more. You are getting more. This is available exclusively to residents of the United States. It takes 30 seconds to check what is open in your area. To get started, click the link on my channel page. If you are on a computer, you can also scan the QR code appearing on screen right now. Open your phone camera, point it at the square, and tap the link that pops up. If you are watching on your phone, tap my channel profile picture to go to the channel page. You will see the link right there. A screenshot is on screen now showing you exactly where to find it. I will be honest with you, thousands of viewers from this channel have already signed up, and spots in these programs are not unlimited. Clinical trials accept a set number of participants, and once they are full, they close. I have seen programs disappear within weeks. If your heart health is something you are worried about, and if you watch this far, it probably is. Do not sit on this. Check what is available tonight. It costs nothing to look, and it could change the kind of care you receive for the rest of your life. Care Health. The link is on my channel page. Do not wait until the next episode of Breathlessness at 3 o'clock in the morning to take this seriously.